Hi, how are you doing?
I'm well, how are you?
Good. My name is Brooke. I'm going to be your student nurse practitioner today.
Right.
And we're going to go through your health history and we'll try to speed through some of these questions since it's a long, extensive questionnaire. And just to confirm, are your initials MS?
Correct.
Okay. And what do you prefer me call you?
MS is fine.
Okay. And how old are you?
27.
27. All right. And do you prefer, what gender do you prefer?
Female.
Female. Okay. And what brought you in here to see me today?
I'm just new to the area, well, not just the area, the country. I'm from London, and I got a new job, and I just wanted to get set up with a doctor.
Okay,
in
with
case
like
something
primary care. Okay, and just to let you know, we're videoing this. It's only for student purposes. So are you okay with the video?
Absolutely.
Okay. And tell me about your past medical history. So, like, do you have any kind of chronic health problems that you take medications for, like blood pressure or diabetes, anything like that?
No, nothing.
Okay. And tell me about any surgeries you've had.
I had breast surgery as a little girl.
Okay.
A knee surgery, and a breast reduction.
Okay. And the breast reduction was for like back pain, shoulder pain, stuff
A lot
like
of
that?
back, a lot of shoulder.
Okay. And your knee surgery, what caused that?
I had a patellofemoral syndrome dislocation.
Okay. And you were born with that? Like,
Mm-hmm.
okay.
And I danced, so they said over years it kind of just walked it up position, had to put it back.
Oh, okay. And your wrist surgery, what caused the wrist surgery when you were younger?
An accident, roller skating. I fell over and cracked the growth plate.
Oh, goodness. Do you still skate?
No, absolutely not.
Absolutely.
I've not touched it since then.
Okay. Well, I'm going to ask you about your family history now. Just whatever you can recollect for your family. Were you adopted or in foster care at all?
No.
Okay. And does your biological mother, does she have any kind of medical conditions?
She has high blood pressure.
Okay.
She takes like a pill for it.
Okay.
That's all for her.
Okay. And how old is she?
She is 55.
55. And she's a female, I'm assuming.
Correct.
Okay. And your biological father, does he have any kind of issues that he does take meds for?
Recently diagnosed with diabetes.
Okay.
But I would assume it would be type 2.
Okay.
But he takes no insulin, just like I guess a pill or something.
Just a pill. And
or
like
lifestyle changes.
Lifestyle, yeah. And how old is he?
52 or 53, something like that.
Okay. And any kind of siblings that have any kind of health history that you know of?
I have half siblings. Nothing's wrong with them.
Okay. All right.
A little wacky, but other than
that. I think we all think that about our siblings. All right. And what kind of medications do you take? Do you take anything, any kind of over-the-counter medications or herbs or supplements?
I take like a multivitamin like women's daily.
Okay.
And I take an elderberry for like immune if I feel a little bit dreary. And then chlorophyll, like the drops in the water. I do that daily.
Daily. Okay. And have you gotten all of your immunizations, like your vaccines, the shots for the flu and COVID-19 and stuff like that?
Oh, absolutely.
Okay, everything's in current. Okay.
Correct.
And what kind of allergies do you have?
Like seasons, like outside.
Okay, like seasonal.
Sneezing, grass, trees. And also have like a fruit allergy, so I'm allergic to things that are like pitted.
Okay.
Plums, peaches, cherries, those type of things.
And your allergies to plum, peach, and cherries, what does it do to you?
Itching, swelling on the lip area, and then like hives. Also, the cherries on the plums, they can make my throat a little feel like it's closing? So I'd really stay away from those.
Okay. Have you ever had to use an EpiPen, which is like an allergy pen that you have to stick in your leg and inject for your allergies?
I have not used that. I just stay away from
you just stay away from the fruits. Okay. And so next we're going to talk about your reproductive sexual history. Some of these questions are going to be a little invasive, but we're just getting a comprehensive, panel. You're new to us, so we just need to know kind of what's going on, okay?
Okay.
Are you sexually active of any kind, meaning oral, vaginal, or anal?
Not at the moment.
Not at the moment. Okay, so currently abstinent. And have you had sex with another person?
Yeah.
Okay.
Yeah.
And do you have sex with males, females, both?
Males.
Males, okay. And over the past 12 months, how many sexual partners have you had?
Well, I had one, but he had multiple apparently, so I don't really know how to answer that.
Okay. Well, we'll just put one partner, but he had multiple because that means you were exposed to multiple as well. What we already talked about the gender. Do you you're currently no sex partner. When you found out he was having sex with multiple people, did you have any kind of testing for STIs?
I did had like all everything that they can think of. I tested
You
me
did it
for
all.
it, and
Okay.
everything came back great.
Okay.
Nothing was there.
Nothing was there.
Perfect.
Good. And how they tested you for HPV as well?
What was that like? Because
The swab.
They did test me for that. Yeah.
Mm-hmm. And then, do you know if your sexual partner, any of your sexual partners, use drugs at all?
No, oh God. Maybe a little like marijuana here and there, but nothing like.
Okay.
Nothing.
Okay. And were you pregnant at all with your last sexual partner?
When I was in the university.
Okay.
But not after that.
Okay, we'll talk about that in just a little bit as well, more in depth. And have you ever exchanged sex for your needs, like money, housing, and drugs? Like, have you ever been like a prostitute?
No.
Okay,
oh, God,
no. Okay. And that question is just really like if we can help guide you out of that situation, if you're in that situation, out of not, out of desperation. So we use that to just kind of guide you out of it if you want to. Some people are proud of that profession, and that's perfectly fine as well.
Right.
And so you've talked about STIs with your partner. When you found out your partner was, assuming this wasn't approved by you.
Oh God, no.
Yeah. So when you caught him doing this, did he go get tested as well for STIs?
Apparently, not apparently. He did. I saw the results. He was clear.
He was clear as well. Okay. Did you
Lucky
and your
for him?
Yes, because you might not have made him clearer.
Right.
So, did you guys use any kind of contraceptives like birth control or condoms?
No. Never.
Okay.
Never.
All right. And how often, like, if you were to go out and meet someone tomorrow and you wanted to have sex with them, would you use any contraceptive
Absolutely.
or condom? Okay.
Absolutely.
Okay. And have you ever wanted to take any kind of contraceptives like birth control or an IUD or anything like that?
No, thank you. I don't like how it made me feel.
Okay. When were you last on it?
Like third year school, so that would be like I guess equivalent to a high school here.
Okay. All right. And how did it make you feel when you were on it?
I don't remember, but I know I didn't like it.
You just didn't like the hormonal changes. And have you ever heard of pre-exposure prophylaxis? It's called PrEP.
No, I don't know what it is.
Okay. So PrEP is a medication that can be utilized to prevent HIV, be it that you may have a new partner or maybe exposed to something. I will get you some more information on that. So be it you're new to the area and new to the country, different healthcare system, I'm going to get you all kinds of pamphlets on everything sexual history related, because that's a current problem going on in your life. And so that way you kind of get a baseline of everything that's available here in the U.S. for
Do I have to pay for it? You pay
no,
for everything
ma'am, you do not have to pay for
Okay.
this is educational pamphlets.
Okay.
And what we like to do, we like to give these educational pamphlets so you don't turn to Dr. Google, because Dr. Google is not always right. So
I do Google it.
Yes,
Truly.
and most people do. Most patients do.
Right.
And you've never been diagnosed for an STI in the past, okay? And so your partner was negative, and his HIV status was negative as well when you looked over his. And so with all of this going on, how have you been feeling? Have you been having depression, anger, anything?
All of the above.
All of the above? And how's your support system?
It's
through
been
that?
good if I'm able to actually communicate how I feel. I struggle with that personally, but they are as supportive as I allow them to be.
As you allow them to be.
Mm-hmm.
Okay, so I just want to encourage you, don't sit through it alone. There's many resources out here in the U.S. that have like counseling resources. We can use psychology, psychiatrists, social workers are even certified to do psychology. And there's all kinds of telemedicine. So we can always get you hooked up with someone. I just don't want you to feel alone. If you get to feeling alone, you give me a call. We'll make the appropriate referrals, okay?
Right.
And we'll figure out cost, because you kind of mentioned cost and everything cost here, and you're right, everything, because you came from universal health care, so it's a little different. And do you think you would like to have children?
At some point.
Okay. And about what age or like
Maybe 30.
30?
Maybe 3 years or so.
Okay. And prevention of pregnancy is how important to you?
Extremely.
Extremely. Okay. So just not ready now. Want to live.
No.
Okay. And so you said you utilize condoms, and if you want to talk about more ways to prevent pregnancy, I'm going to include all those brochures. If you want to talk about it, just give our office a call. We'll make a whole nother appointment and kind of talk about that kind of stuff if you're interested.
All right.
So let's talk about your menstruation history. When did you first have your menstruation or period?
Like 12 or 13.
Okay. And tell me about your regularity. Are you regular with your menstruation cycles? Okay. Tell me about that.
It'll like be regular, maybe around the same day for a couple months, and then it'll like skip a month, and then whenever it regulates back, it'll be the new month. It'll stay there, so it'll stay regularly irregular.
So this has been going on your
The
whole
whole
life?
time. Yeah,
Okay.
absolutely.
And your duration and length, is that normal for you?
That stays like 4 days, starting on 5th.
Okay. So that's pretty normal for you. And you said you were pregnant at 21. Did you have a live birth with that pregnancy?
No, it wasn't miscarried, but I didn't know that I was pregnant.
You didn't
so
know.
it
Okay.
was just,
Most people that have that miscarry in the first pregnancy don't even know they're pregnant.
Mm-hmm.
So, and so you didn't have any kind of complications. You just thought you had a period, but you actually had a little bit of a miscarry. It was different. And so have you experienced any infertility? No, because we talked about that. And have you undergone any fertility treatments at all?
No.
Okay.
No.
And so if you go through infertility, you start trying to get pregnant and you feel like you're infertile, have you ever heard of polycystic ovarian syndrome?
Actually, yeah.
Okay. Did you Google that? Okay. Do you meet a lot of the symptoms for that? Okay. All right. And so the last pap smear you had, did they clear you of polycystic ovarian, or did they even say anything about it?
They didn't say anything about it.
Mm-hmm.
So
it's kind of a hard diagnosis.
yeah.
I'll give you some more information on so you can have current right information. I don't know what you read on Google. I Google everything too, but I try to give the correct information to my patients. So if you are going through trying to get pregnant, infertile, we'll talk more about PCOS and endometriosis. And you have not gone through any kind of issues with menopause at your age, and no breastfeeding. Have you ever felt like anyone has hurt you physically, insulted or talked down to you as a sexual partner, as a domestic partner at all?
My very first boyfriend back in high school, but that was before that relationship I was in currently.
But not the current relationship,
No.
and not within the last year?
No.
Okay. And did the first boyfriend ever threaten you with physical harm or scream at you?
Mm-hmm.
Did he ever cause physical harm?
Mm-hmm.
Okay. And did you seek any help for that?
Mm-hmm.
Okay, so you sought out some treatment for trauma. Okay, great. Do you need any more help with that at all? Okay. And now we're just going to brief social needs, just kind of because you moved to the area recently. Do you have a stable place to live? Okay. And so no homelessness or housing instability in the past year? Great. And reliable source of income. Are you working?
Currently, yes.
Okay, and what do you do?
I work as like an oncology specialist, so I
Okay.
work in cancer care.
Great.
That's why I was proactive with this, trying to get my doctor's appointments.
Absolutely. And any kind of challenges or stressors at your job currently?
This is my first week, so no, not yet, but
Not
I'm sure
yet.
there will be.
Good. Any kind of financial difficulties recently with your move?
Well,
Yes. Okay, that's okay.
America's expensive.
It is very expensive. So when does your insurance kick in? You were talking about your insurance?
Couple of days here.
A couple of days. Okay, so if you need some assistance with this visit, if you need some assistance, just let us know, and we'll help with a payment plan or some sort of assistance, okay?
Okay.
Do you have enough food in your home right now?
I do.
Okay. And any kind of dietary needs?
Vegan.
You're
so
vegan?
Don't
Okay.
eat anything really. Just fruits and vegetables.
Just fruits and vegetables. All right. And any kind of issues getting to medical appointments, like transportation issues?
No.
Okay. and any kind of, we already talked about social support network. You said you had a great network if you let them in. So,
It's more me.
it's more you. Yeah. Just make sure you're not closing yourself off, like we talked about. And did you serve in the military at all?
No.
No military service. And tell me about your tobacco use.
None.
No tobacco use ever?
Never.
Okay. How about vaping or e-cigs?
No. None.
Okay. And what about recreational drugs? Like weed or pills? Nothing like
Nothing.
that? And what about alcohol?
Absolutely.
Absolutely.
I love alcohol.
Okay.
For crying out loud. I do is drink.
All right. And how often do you drink?
Really, maybe like a glass of wine weekly, and then socially have a couple shots here and there.
Okay, socially, all right. And that is perfectly acceptable, not looked down upon. Just make sure it's not a problem. And do you feel safe in your community where you live?
Absolutely.
Okay, great. And how comfortable are you with like health information? I mean, does it feel weird being in America? Like, do you feel like you understand when you get health care? Like,
no, I don't. I'm a little nervous because like I said, we don't pay for anything over there, so I guess getting used to the guidelines will be new. But
okay.
I will have to understand it considering what I do for a living. So
right,
I'm
right.
hopeful.
You will learn it, but if you need help, like during visits, just make sure to let us know that you need the breakdown of the insurance, because that is it's a little confusing. Do you feel most comfortable in English, speaking English? I'm assuming. Do you speak any other languages?
No.
Okay. And immigration status. Do you have any issues right now with immigration since you moved out of the country?
No, it's getting worked out, but because I work and everything, it's a little easier for me.
So you have like a work permit.
Mm-hmm.
Okay. And if you ever run into issues, we can try to get you some kind of like help, okay?
Right.
And is anything in your cultural background that you need, that I need to know about you?
Not really.
Okay.
Just getting comfortable with questions. We don't really talk that deep in England. But
okay.
Nothing
Getting
else.
used to being questioned like that.
Yeah.
I gotcha. All right. Well, it was so nice to meet you. We've got everything established. So what we'll do is we'll probably pull you back in a couple of months, because you're a very healthy person. We'll just pull you back in a couple of months when you have insurance, and when you're due for your pap smear, we'll get you in here and get everything done for you.
Perfect.
Okay? Nice to
Thank
meet
you.
you.
Nice to meet you.